I'm declaring a public health emergency of international concern over the global outbreak of novel coronavirus. The main reason for this declaration is not because of what is happening in China, but because of what is happening in other countries. Our greatest concern is the potential for the virus to spread to countries with weaker health systems and which are ill-prepared to deal with it.
Hi there and welcome to Power in Politics. I'm Vashi Kapelos. The coronavirus outbreak is now a global health emergency. Members of the World Health Organization made that declaration this afternoon following their third meeting in Geneva in a week. There is now additional urgency to get the 196 Canadians who've asked for help out of China's Hubei province, where millions are under quarantine. The federal government says it has secured a plane, but has not yet said how or when the airlift could begin. Globally, more than 7,800 cases have been confirmed, according to the WHO. Most of those are in China. That country now has more cases than it diagnosed during the SARS outbreak of 2002 and 2003. The death toll sits at 170, making it less deadly than SARS. Outside of China, 98 illnesses have been confirmed across 18 countries, and that includes 3 here in Canada. So how fast can the government get Canadians in Wuhan out? Earlier, Foreign Affairs Minister François-Philippe Champagne stopped by the Bureau. I caught up with him as he was leaving to ask about that. Does the WHO decision now make it so that it's much harder to get Canadians out?
No, I would say I think in the decision of the WHO was really to make sure that all healthcare systems around the world would be on alert. I would say thanks the Canadian system was already all set up to deal with this health emergency. No, I would not think that would have an impact. Now,
you don't think China's going to make it harder to get people out?
Well, listen, I only goes on the basis of facts. You know, like I said, there's only 2 planes which have taken off from this area. You had the U.S. plane, which was primarily evacuating consular officials with their families. And then you had a Japanese plane which just left a few hours ago. So
other countries have landed planes, though. For example, Germany, I believe?
Well, the latest information that I had, no. But depending, I mean, it's a very dynamic situation. The latest I had of a few hours, you only had the American one, but this was negotiated with the Chinese authorities a number of days ago. And you had a Japanese flight which left. The UK, Canada, South Korea, Japan were all negotiating, obviously, with the Chinese authorities to get the landing rights, but also to prepare the manifest, because not only we need the landing rights, but as you would appreciate, since the whole area is on lockdown, that manifest then needs to be shared by the Chinese authority with all authorities to make sure that people, when they leave physically their home, they can get to the airport. So we're dealing with the permits on one end, authorization, but also the logistics. You have about, 6,000 cabs, which are legally allowed to move around the city. So we have a team in Beijing. I spoke with the Canadian ambassador to China twice a day. We make sure we have a rapid reaction team to go to Wuhan to make sure that we can assist Canadians. So,
have the Chinese signaled to you, though, that they are open to the Canadian plane landing?
I have heard nothing to suggest that they would not allow a Canadian plane. We have asked for the same treatment that has been offered to other nations, and I'll be talking to the Chinese minister to get reassurance tonight. But so far, I would say the process is well underway. The Chinese authority know that we intend to send a plane. This was done overnight. We're working on 24/7 basis. So
did you wait too long to ask in the first place, though?
No, because I would say you have to look at the situation. On Monday, we had 2 people who wanted to be evacuated. Now we're up to 196. Let me remind you, yesterday was 144. So it is a very dynamic. We have about 335 Canadians in the area. Not everyone wants to be repatriated. So we're talking to them. Some decided to stay. Some wants to be repatriated. That's why in our planning we had estimated there'd be about 200. So that's why we have secured a plane which can carry all these people on board. And now we're just going to the process. And I spoke to my British counterpart yesterday. They're doing exactly as we do, negotiating obviously all the authorizations, because you appreciate once you have the landing rights, you need to share the manifest with all the local authorities so that the people can actually leave their home and go to the various checkpoints to the airport. So we're in the process of doing that, and every signal that I've received suggests that we are getting the cooperation we need from the Chinese authorities.
Thank you, Minister.
Thank you.
That was my quick conversation with Foreign Affairs Minister François-Philippe Champagne not long ago. But we do have more questions. And for that, we're joined by Rob Oliphant, the Parliamentary Secretary to the Minister of Foreign Affairs. Hi, Mr. Oliphant.
Vashi.
Let me pick up on something Minister Champagne said, and that is the negotiation process that's underway. Are we essentially, at this point, trying to secure landing rights? Are we trying to get China to agree to let us land?
That's right. I mean, our first priority is the health and safety of Canadians at home and abroad. And so when you start to go through that process, you want to have a process that safely enters China, respects their border integrity, finds a way to work with a very complex situation on the ground where you've got people who are not all in one place but need to transfer to get to an airplane. Then you want to get them home, and you want to make sure that Canadians at home are protected as well. So you want to make sure that you're doing this carefully. And so we're not dividing, there's no hierarchy of whose health is more important. The health of all Canadians is important. We've so far had no limitations or restrictions from the Chinese. We're going through ordinary processes. They, of course, want to make sure that they're doing their part to not spread the virus. I mean, they're being responsible.
You're not letting
as well.
anyone who's sick leave, is what Dr. Tam, I think, said, the chief public health officer in Canada.
Yes.
Have they said that to the government?
I heard that today in the House, that Minister Haidu said that indeed that is one of the considerations.
Do you know how many of those 196 Canadians are sick?
No. And I don't know whether any of them are. We were assessing that, and as the Minister Champagne had just said, we've gone from 2 on Monday to 196 today wanting consular assistance, and so we are preparing for that. We made arrangements to have a chartered plane within hours. The Minister made the decision very quickly, following Treasury Board rules and contracting to make sure that everything is done appropriately, and hopefully within a matter of days we can do that.
That's what I want to follow up on. What is the expected timeline for this, and is there anything nefarious about the way in which China is taking part in these negotiations? Do you think that the will and the intent is there?
That was the first question I asked. I'm obviously on the special committee looking at the bilateral relationship between Canada and China.
It's not a pretty one right now.
It's a complex, difficult relationship. I have had no information to say that there is any a barrier or any kind of limitation being put on us, that China is doing everything they can to ensure that their people are healthy and that the world is not infected.
Okay, I want to ask about who specifically can get on that plane, and understanding that not all the information is available. But we had a gentleman who was on the show, Monty Ginsberg, I believe is his last name. I apologize if I'm mispronouncing that yesterday. He has a daughter and a wife who are permanent residents. He received in Canada. They're in Wuhan. He received an email today from the Emergency Watch and Response Center at Global Affairs Canada in Ottawa. We have been informed, it says, that only Canadian citizens who have entered China with a Canadian passport will be allowed to board the plane. Our policy is to keep families together whenever possible, and we've raised this with the government of China. However, the Chinese policy is that only Canadian citizens traveling on their Canadian passport will be permitted to leave on this aircraft. Is it your understanding that no permanent residents will be allowed to come back to Canada?
I don't think that's declared yet. The reality is we know that those who have Canadian citizenship that entered China with a Canadian passport have priority and are understood by the Chinese government to have that ability to come home. That doesn't exclude others. And so we have Chinese Canadians who have entered on a Chinese passport. We have permanent residents who may have a passport from China or another country. And so it gets complex diplomatically.
China doesn't recognize dual citizens.
Absolutely. So they would have to recognize a Canadian citizen. And what we're hoping for is flexibility. And so what our minister is speaking to his counterpart tonight to explain that we want to help. And this is to help China as much as it is to help our citizens as well, to make sure that we're able to do our part. And we're offering other assistance to China as well in terms of medical assistance, equipment, anything that we can do that they may have a need for.
Is there a dollar value to all that's being offered?
No, we haven't. We've just said, you come to us, and if we can help you, we're here to help.
Has there been an ask?
Not that I've heard of. As of yesterday, I had not heard that there had been an actual.
I just want to make sure that we're clear here, because you're saying your understanding, at least as I understand it from you, is that there perhaps could be some flexibility on the part of the Chinese
That's
policy.
our hope.
This letter is very explicit. The Chinese policy is that only Canadian citizens traveling on their Canadian passport will be permitted to leave on this aircraft.
That's what we've been told.
There's no hope given to this gentleman that things could change.
Well, then I don't know what citizenship. These are all privacy issues. I don't know what citizenship his family holds, and that there may be other vehicles. Our goal is to keep a family together. Our goal is to do this as expeditiously as possible and to help. And so we will make that case, and we're hoping, given the nature of an international crisis, that this is an international health crisis, that there will be some flexibility.
Have the Chinese signaled that there will be any flexibility, though? And I'm asking because, again, of the kind of actor China is in the international community right now.
And I'm not aware. I'm not privy to that information. I'm not in those conversations. I know that we will stand up as much as we can to keep families together and to make sure that our citizens are brought home and that we help their families. I think there are about a dozen permanent residents that so far have registered.
When the plane lands, what happens? Have any decisions been made?
That process is being now looked at, and it's fluid too. We want to know who's on the plane. We've not been able to ascertain their health condition.
Why not?
We're not on the ground there. This is in quarantine. The whole city is in quarantine. You can see the pictures of the streets. They're vacant. We don't know, and so we know that the direction that Public Health Agency of Canada has, and is their understanding that their goal is to keep all Canadians safe.
Does that say to you that they will be, for example, quarantined when they come? Will we follow the American example where they go to a base?
We are working with international partners to find best practices, to make sure that we're an evidence-based government. So we want to make sure that we won't do anything that will jeopardize that it is the best health care for the people who are arriving, but also protects Canadians.
With respect to that, I take your point, and I understand that. I'm not trying to say that that's not the case, but Canadians have no indication of what, I mean, for 3 days now, there's been no indication of what you're even considering.
So what we're trying to do is be as open and flexible. Everything is on the table. Minister Haidu has been very clear that we will do what it takes to keep Canadians healthy and Canadians safe. And so we'll do that. But the plan, she said, will become transparent as it unfolds and as the needs. I mean, you can't come up with a plan until you know exactly what the needs are. And there is now a declaration. We have very strong systems in Canada. We've learned lessons. We know about infection control. We know about stopping the spread of a virus. We know epidemiology and how that would work. And we want to protect people. And so, but we also want to make sure we're doing it step by step, carefully, and making sure that, the principle is do no harm. So we are following that basic principle of do no harm.
Okay, I'll leave it there. Thank you, Mr. Oliphant. Appreciate your time this evening. Rob Oliphant, Parliamentary Secretary to the Minister of Foreign Affairs.
The World Health Organization's global emergency status is really, as I said earlier, about helping countries that do not have the same level of sophistication as Canada or perhaps the United States to protect their citizens if in fact they have a citizen who returns from China who is ill or who has been close to someone who has returned from China who is ill. This has been working very well in Canada because we've actually been able to detect cases very quickly, support those people to get better, and prevent the spread of disease. And what the World Health Organization is saying is that we've got to make sure that other countries can do that as well, because it is in the interest of world health that we support everyone in this process.
As the death toll climbs and the number of cases spread, the federal government has continued to assure Canadians the coronavirus risk in this country is, quote, very low, even after 3 cases were confirmed in Toronto and Vancouver. Now the outbreak has been declared a global health emergency. So how does that change the way health officials in Canada should respond, or does it? Should we be worried about a SARS repeat? Dr. Isaac Bogosh is a clinician investigator at the Toronto General Hospital Research Institute and joins us now from Toronto. Hi, Dr. Bogosh. Thanks for making time for us.
Oh, no problem.
Can you help us understand what this declaration by the WHO means? What's the significance of it?
It's pretty important. Instead of countries acting in isolation, we're basically uniting together as a team to really get this epidemic under control. Currently Canada has their own preparedness, and every other country will do what they need to do. But with this declaration, there's going to be better coordination, more data sharing, and of course, support for countries that aren't as fortunate as Canada to really prepare for the potential of imported cases.
And where specifically would that be? Because that is sort of what I gathered as a significant part of this declaration. This is really to help a lot of countries that don't have the resources that Canada does or the U.S. does, for example, to deal with something like this.
Yeah, I mean, like the World Bank really sort of divides countries up as high income, middle income, and low income countries. And of course, many of the low income countries or low middle income countries just don't have the same public health capacity that we have. We know that, obviously China is a country of 1.4 billion people. We know we're living in the most mobile era in the history of humankind. And we know people can and will travel. And we know that people have traveled with this infection and landed on the far corners of the earth. So there's already, about 16 or 17 countries now with an imported case. And of course, this is not restricted to France, Canada, the United States. It can certainly go to other countries that have fewer resources. So really, with this declaration, it'll do a number of things. But the low-income countries that just don't have the same ability to detect cases coming in, or perhaps do the case detection and contact tracing that's so important to see if anyone else was exposed to this. They just don't have that capacity to do it, and certainly this may enable them to do so.
Does this declaration change at all the risk assessment here in Canada? And I'm asking that because even though it seems kind of counterintuitive, because obviously we have our own set of conditions here, the last time I had the health minister on, when I asked about what generated or what was behind the risk assessment in this country, she very quickly referred to the WHO. And so I'm just wondering if there is a connection at all.
No, I don't really think so. I mean, if we look at, we have to, it's funny, we have to timestamp every conversation because it is an epidemic and things are changing day by day. But as of right now, we've got 3 cases in Canada. No one would be surprised if we had a few other cases. But I think it's extremely important to recognize that it's not just in China's best interest or, low-income countries' best interest. It's in the world's best interest, of course, including Canada's, to get this under control as quickly as possible. Because if this continues to progress in China, and there are cases that, and if there are cases that land in other places, and there's other foci of infection in different parts of the world, it's going to be harder, for example, in Canada to detect incoming cases. Someone used the analogy of catching a fly ball in the outfield. And if 1 or 2 or 3 come in, you can sort of run around and catch them. But if you're getting inundated with them, some are ultimately going to hit the ground. And currently our public health system and our capacity to manage this here in Canada has been remarkable. But of course, if we're inundated with cases, if other places are inundated with cases, it's going to be a lot more challenging.
Does that make what's being done at the source of the outbreak all the more important? And what is your assessment of what China has done and is doing?
Yeah, I mean, 100%. I mean, the whole goal here is go to the source and mitigate transmission at the source. That is crucial. Now, it's in the history, again, we've never seen this before. This is unprecedented. China has essentially stopped virtually all mobility for something like 40 to 50 million people in Hubei province. No flights in and out, trains and buses, both in and out and within the city have been restricted. And in the past, when you were talking to physicians or public health providers or whomever, we'd say, these travel restrictions don't really work. It's hard to extrapolate from prior data to this because nothing to this extent has ever been attempted. So, certainly China is, they're clearly taking this very, very seriously based on the enormity of the policies that they've imposed in their country.
And so what should we, as people who are not as much of an expert as you, I just feel like a lot of time we're watching the news and we're seeing the count, particularly in China, go very quickly, right? I think about a week ago when we were talking about a couple hundred cases and now we're talking about thousands of cases. Is that, to what degree should that worry people? And what are you watching for to figure out if we should be worried in the coming days?
Yeah, very good point, because there's many different things that can go into why those counts are going up. One reason could be there's just more people getting infected. That would be unfortunate. But there's a lot of other reasons as well. Certainly there could be an increase in diagnostic testing, an increase in awareness. This could be just related to how they're reporting their data in clumps rather than as a trickle. So there's a lot of reasons why we might be getting increases in the number of cases. I think the key issues here are, is there significant transmission outside of the areas where there's this travel ban? Because, I think, if there are significant chains of transmission elsewhere in the country, it's going to be a lot more challenging to get this under control. If those are rather limited, I think it's going to be a lot easier for their public health mechanisms to get it under control.
All right, I'll leave it there. Thanks for all the information. I appreciate it, Dr. Bogosh.
Anytime.
Dr. Isaac Bogosh, clinician investigator at the Toronto General Hospital Research Institute. There is now more urgency to get the 196 Canadians who've asked for help out of China's Hubei province, where millions, of course, are under quarantine. The federal government says it has secured a plane, but can't yet say how or when the airlift will begin. Other countries, like the U.S. and Japan, already got some of their citizens out. So did Canada wait too long, and what happens next? Patricia Forche is a former Assistant Deputy Minister of Security, Consular and Emergency Management at Global Affairs Canada. She's now a Senior Fellow at the University of Ottawa and the Canadian Global Affairs Institute. Hi, Ms. Forche.
Hello.
Nice to see you. I want to preface also that you have experience in bringing Canadian citizens back from areas of conflict or areas of devastation like Haiti, Libya, South Sudan, I think you mentioned as well. Mm-hmm. So help us understand what might be taking place behind the scenes. When the minister comes on here and says, we're negotiating with China for landing rights and there's a whole process that has to happen, what does that mean?
Well, first of all, the decision has been made to go for evacuation. And that's not a decision that's made lightly. It's usually the last resort, because usually it's faster and cheaper and just easier to get people out different ways, on commercial flights, using shared planes with other countries. So they've come to this decision. There's no commercial flights, and it seems that because of the quarantine requirements, that other countries probably can't take other citizens because you're going into quarantine. So I think that this is one of those ones where there wasn't much wiggle room and they had to find a plane. And it's hard to find a plane at the last minute when all the planes are taking off, because when the Government of Canada issues a travel advisory, like the ones we've seen, avoid non-essential travel, avoid all travel, that means that insurance becomes very hard to come by for people and for planes. So then what you're asking is for a charter company to assume a great deal of risk to go in there. And that's costs money, and you have to find somebody who's willing to do it. So that's the first stage. That's already happened. So that part of the puzzle, that part is done. Right. And I think it's coming together because now we have the WHO that we just saw, their declaration, and they've said, okay, this is a public health emergency of international concern. But what they've done is also urge restraint. There are a couple of pithy phrases there. Facts, not fear. Solidarity, not stigma. And I think what Dr. Teodoro, the Director General of the WHO, was trying to say is, let's head off that other contagion that is panic. So let's hope that other countries react as with restraint.
What does that declaration mean, though, for China's calculation in determining who lands, when they land, if they're able to take citizens out? Does it affect it at all?
Well, what the WHO has said is not unnecessarily restrict travel and trade. And in the question and answer afterwards, I heard them say, we want them to lift some of the visa restrictions. We want to lift some of the border closings. So I think that reconsider is what they said, but it sounded to me like that's diplomatic language for lift.
Right.
So the discussions with the Chinese now will be, we've had the Americans go out, the Japanese go out. The Japanese were close. The Americans had a mission there, and they took out consular staff with them. So that was an easy way of getting people out because you had diplomatic staff being evacuated. We are in a different position. We don't have a mission in Wuhan. We're going to say to the Chinese government, we want permission to land. We need to be able to go out and help our Canadian citizens get to wherever we're landed. And then we need to have your approval for every person that gets on that plane. So this is a lot we're asking. So it's going to be a long conversation. We're going to have to work very closely with them. I have worked with the Chinese before. I worked with them in 2011 on the Libyan evacuation, as well as in South Sudan. I found them very practical, very pragmatic.
And let me ask you something, and this might be a naive question, but I think from this vantage point, it's difficult for many of us who for the past year have spoken about a breakdown in the relationship between our country and their country to think that that will just be put aside. But is that in fact what might be going on? I would hope so. I would hope so, because what we've also seen is the WHO praising China and saying, you know, China's gone above and beyond. This is a model response. And if you compare what China has done now with what happened in 2003 with SARS, when they underreported to the nth degree.
Look at these. This is something really different. They're on their best behavior in terms of being a world citizen. And I would hope that they would follow through. And, you know, as the British are moving forward, the Australians have plans, a little different than ours. And, you know, we have plans. And I think that's my hope, is that it goes forward.
The other consideration that keeps jumping out at me, and this is something we heard from someone who has family there, for example, is that they don't recognize dual citizens, that they're not letting permanent residents get on. How difficult do you anticipate that is? Is that part of the negotiations? Do you see any room for flexibility on the Chinese part there?
That is very difficult. We have an agreement with China, which says basically there's dual citizens, but if a Canadian goes into China and wants to be recognized as a Canadian citizen, that Canadian citizen must use his or her Canadian passport. If they don't, and many unfortunately do not, because it's kind of easier to slip through the domestic slot, they're not necessarily recognized as Canadian citizens. So I'm hoping this will also be another discussion, and it might be more difficult.
All right, I have to leave it there, but thanks very much for your insights this evening, Ms. Forche.
Thank you so much.
Pleasure to have you here.
Our goal is to keep a family together. Our goal is to do this as expeditiously as possible and to help. And so we will make that case, and we're hoping, given the nature of an international crisis, that this is an international health crisis, that there will be some flexibility.
Some permanent residents of Canada who are stuck in the coronavirus region in China learned today they're not allowed to leave. Ottawa is expected to send a plane within days to airlift 196 Canadian citizens out of the area. But what about those left behind? Monty Gisborne's wife and daughter are currently in Wuhan. He joins us now from Coquitlam in BC. Hi, Mr. Gisborne. Thanks for making some time for us again.
Thank you.
Before I get to your reaction to what you've learned and what we've learned about permanent residents, I just want to ask about your wife and daughter. How are they doing?
Physically, they're fine. Everybody in the domicile are doing the best with what they've got. Nobody, not a sniffle to be reported. They are healthy, just concerned.
How has the sort of lockdown in the city affected them and their day-to-day life? What are they able to do?
Well, it's not the day-to-day life that they went there hoping to enjoy, you know, especially during the Chinese New Year, which was the reason why they went there in the first place, to celebrate that with family. They've met none of the family members except for my wife's mother and father, where they are staying. They're keeping up a cheerful disposition about things, but that's their nature, and that's what I love about them. They shoulder these things very well, but at the same time, they want to come back home.
So let's get to that, because yesterday when we spoke, you were going to reach out to the government, and it's my understanding that you did, and that the permanent resident status of your wife and daughter is affecting their ability to get out. What did they tell you? What did the government tell you?
Well, today I got the first clear communication from the government that that the permanent residents that are in Wuhan will not be enjoying the same protection as other taxpayers of Canada.
And in essence, that means that they won't be, because the Chinese government's policy is as it is, they won't be allowed, your understanding is, to get on the plane.
They cannot get on that airplane. That's not being set up for them. They're persona non grata in the government's viewpoint, and that's my interpretation of it.
So we did have the parliamentary secretary to the Minister of Foreign Affairs. I asked specifically about your case and about permanent residents, and he seemed to have the impression that there might be some wiggle room, that there might be an openness, given the declaration with the World Health Organization today, that it's a case that they are making, at least to the Chinese government. Does that offer you some comfort?
It's the first I've heard that, and yes, it offers any piece of information, that's coming from a viable source is appreciated. And if it's coming from them, I'm listening. I know that they don't want to play the meanies, the bad guys in this story. I don't understand why they would not include them in the first place. But if there's wiggle room, as you say, and if there's an opportunity, oh boy, I'll be pushing to get them on that airplane. And I'm sure that they're not the only permanent residents over in Wuhan.
I think there's about 12 of the people who have contacted the government so far. That's what Mr. Oliphant, the parliamentary secretary, said to me. My understanding is it's China that's prohibiting them from leaving, right? That it's China whose policy this is. So this would require the federal government here to negotiate that with China. Are you concerned at all about the Chinese government and whether or not they will bend on this?
I think that if push came to shove, they would not stand in the way, but they might offer some initial resistance to such things. I don't know. I'd be speculating at best to say what they would think, because I've never understood how that government works in the first place. So, but that's fine. I hope that the wiggle room that my local officials are talking about brings forward the discussion with anybody that needs to be in this discussion to just let the permanent residents go. There's no reason to keep them there.
And have you had any further contact beyond what the government said to you today, and that was China's policy? Have you had any further contact with them? Have they indicated to you what kind of timeline there might be? Anything like that?
Nothing so specific. It was a one-liner email sent to me, basically, that permanent residents were not being considered for any flights out of China coordinated by themselves. It was simple. It was blunt and to the point that basically, that they're not considering permanent residents not at this time, just period. Right. So if there's any wiggle room, like you're offering me this information, I have not heard that directly or indirectly. I'm delighted to hear it. I encourage my government to pursue that. I can't see what the loss to the government would be to include the permanent residents, who again are full tax-paying members of society and net contributors to Canada. Let's bring them home.
And are your wife and daughter in touch with any other Canadians there? Is there any sort of discussion about other people leaving and sort of the way in which people are feeling their desire to get out?
Yeah. Now, one of the issues here is that a lot of the communication, of course, media, website, et cetera, it's all in English. We're talking about a largely Mandarin-speaking population. So I believe that there are a great number more of both Canadian citizens and permanent residents in the Wuhan area or other areas that are under lockdown who simply don't know how to communicate with the government, who don't have the fortunate benefit of a English-speaking counterpart in Canada, perhaps like my family does, to do that. We're trying to reach out to those people. My wife's doing an incredible job of reaching out to people that she knows. And if you know how WeChat works and the groups that get organized, there's a group that's being a Wuhan Canadian group that is being set up. And my wife is sort of spearheading this and educating others because they have no idea what's going on. And all they're hearing is the Chinese official party line on things. And if you think they're covering, the Canadian plight, they're not. So, they feel stranded and helpless. And my wife is trying her best to educate others in the hopes that we all see an end to this.
Okay, well, we wish the best, and we're thinking of you and your family. Thanks so much for sharing some time with us today, Mr. Gisborne.
Thank you. Thank you for the opportunity.
Monty Gisborne from Coquitlam in BC. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.